Hi, everyone. Welcome to the GEMSS webinar with Karen Volle. We're excited to have you all here. I'm Emma, the genetic counseling intern with Rare New England. Karen has been with the Institute on Disability at the University of New Hampshire since February of 2008. Karen's work spans two areas, the first being the New England Regional Genetics Network, also known as NERGN. And NERGN aims to improve health equity and health outcomes in individuals with genetic conditions, reduce morbidity and mortality caused by genetic conditions, which include congenital and metabolic disorders, and to improve the quality of coordinated and comprehensive genetic services to children and their families. The second area is related to research on policies around employment with people with disabilities. So it's an honor to have Karen with us today, and we would like to give our attention to Karen as she talks about genetics education materials for school success. As a side note, please put all questions into the Q&A box, and towards the end of Karen's talk and beyond, we'll have the opportunity to have them answered. So with all that being said, Karen, it's a pleasure to have you, and thank you for coming as a speaker, and spotlight's on you.
Thank you. Thank you. I really love coming here, and it kind of feels like I'm having a visit with my extended family, which, as you know, is rare and wonderful. So thanks again just for having me here. I'd like to talk a little bit about an overview of the agency where the GEMSS website is kind of housed. It's part of the New England Regional Genetics Network, or NERGN. Thanks, Emma, for giving a little introduction about that already. Then I want to share why I'm here, why I got connected to NERGN in the first place, and why it's personal for me as I go through everything I can learn and share with you. Then I'd like to move on to the GEMSS website, how it was envisioned, what made us undertake this, what do we hope to achieve with it. Specifically, I'd like to spend some time on the healthcare for providers part of it, which was kind of one of the later enhancements that we did of the website, and then kind of show you how the content is organized. With any luck, that will be on the website itself. All my links work. So the mission of NERGN, again, is to improve health and well-being of people living with genetic conditions in New England. We are one of 7 regional genetics networks across the country, and we're funded by HRSA, and very appreciative of that funding, of course. Being part of a network of sister organizations has been really just awesome for us. We're all working on the same kinds of things, but people are doing it differently, and we share and we help each other, and we have policy updates and kind of things that we all seem to do a little bit better. So it's been a really collaborative way of sharing. Most recently, we met with folks from the Midwest who has a lot of luck connecting with their American Indian population, because that's one of the things we're trying to do more here in New England. And my next bullet point is just to kind of underline that we're focusing on connecting underserved communities to genetic services. And we're also really spending a lot of our time focused on telehealth and telegenetics specifically, like we all are. We've had a bit of a transition recently, so I wanted to put up, kind of show who our leadership is at the moment. Kim Phillips is our newest member as of, I think she passed 50 days as the director this past week. And she's somebody I've actually worked with for years at the Institute on Disability. She has an awesome background in public health and health equity. So that's just been a wonderful addition to the team. You might recognize Leah Burke, who's a geneticist from Vermont, who's been with us as long as I can remember. from the very beginning in the planning committee, and she's now a bit more active as a consultant with us. Ed Closa, hopefully some of you got to see his presentation about an hour ago, and then myself. Our activities right now, as I mentioned, are focused a lot on telehealth. And I wanted to call out a couple of specific examples. We work with the Weizmann Institute in Connecticut to utilize they already are up and running an ECHO series. And ECHO is a way of, from a non-clinical person here, it's a way of sharing information from a hub of people who maybe are the experts and the people who are primary care providers out in the field who can learn in these really good 90-minute sessions that often involve case studies and time for question and answers. It's a really successful model. We are integrating genetics into that ECHO series. Mark Corson is one of the stars of the show for that. Mark also helps with a kind of a separate genetic webinar series that is just a series of more shorter, something you can get over the lunch hour, I think, series of hot topics in genetics. Another area we're working with is with the Bay State Health Center. And I have a photo of Dr. Mary Alice Abbott, which some of you may or may not know, but we've been trying to, we really want to increase the number of telegenetics clinic appointments. And so we're doing that by helping right now fund genetic counselors in Dr. Abbott's clinic to do telemedicine. Interestingly, for those of you interested in genetic counseling, it's so vital, but it isn't always paid for by insurance. So there's a little gap there. And we're able to, among other things we're doing with Bay State, we're able to pitch in a little bit right now. Hopefully the laws will change with regard to that in terms of genetic counselors being covered more routinely, just a plug. Another activity that we have is an annual training of telegenetics for genetic counseling students, as well as genetic counselors. And it's a very kind of intensive module that is also proven to be extremely helpful for people, and people can get CMEs for participating, and we've had a lot of success with that. Another, not telegenetics necessarily, but we do provide through an e-consult service, also with the Weizmann Institute. NERGN has a way to help physicians who have questions about genetics call and get some expert help from one of our experts. Other activities that are kind of major focus for us is working with other family-led organizations. Ed Closa talked about this a little bit. We really have found that if the tie between the family voices or other similar agencies and a genetic clinics, if we can strengthen that tie, it could just help families so much. I would love to see whenever an appointment is made at a genetics clinic, if it was a standard practice to refer those families to the Family Voices organization while they're waiting, especially if, if the wait is 6 months, a year. It's just really key to have those early connections. In addition to the family organizations, there's a lot of other regional organizations like Rare New England and the New England Regional Genetics Group, NERG and NERGN, both exist, both are different, both are similar, and that's another presentation. But we work together very, very closely with that group as well. Our final activity I wanted to focus on was just pooling resources on our website. It's great to have kind of a one-stop shop. I can't say we're that exactly. I think we're getting better with that, but there's so much information. And we need to continually try to cull what we have up there so that it's really what you need when you need it, not overwhelming. But what we do have does address kind of specific issues like newborn screening and navigating the insurance appeal process. We have videos that are for providers, for healthcare providers. We have special resources that are geared towards family support staff so they can help their families. And we also have specific resources for schools. So getting on to the school section, I guess I want to take a little detour first and share with you why I feel like I'm here with my family a bit. So to do that, I want to introduce you to my mom. Here's a photo of my mom who had Huntington's disease. And I'm at risk for that. If you don't know about it, it's a autosomal dominant condition where every child has a 50% risk. So right now I'm living at risk for that. And it's been a long road and a wonderful road in so many ways. When my mom was first diagnosed, I just remember the day really clearly, of course. I went and spent the evening with my dad, and my mom went to bed and I sat on my dad's lap. I was 37 when she was diagnosed. My dad's in a wheelchair because he has MS, but we clunked along and just cried quite a bit. I was a crier anyway. But my dad said, there's still good in the world. There's still good in the world. That's been a foundation for me. And it's made me kind of starting from that place of really living with terror on a daily basis for quite a long time. From there, I have feel like I've just grown and evolved so much so that I'm actually able to be here talking about this out loud with you now. And as I've done that, a lot of it has been really helped by my connection with NERGN because I was connected to other people who were working on genetics. I really didn't care what area you were working on. I just want the smart people to work on genetics and I want to help. And I realized I was kind of an advocate, and more I don't know what lifted, things seemed to lift and settle for me. And I wasn't quite the same person I was initially. I was more confident and more able to put myself out there and help other people and be helped by other people. And all of that's just kind of done it through this unexpected connection. So that's how I feel like I'm making my headway on stigma from my own family condition. But I invite others to be connected to somebody, somewhere, sometime. I don't care what, but you're not alone. And I guess that's just all I want to say. So on to GEMSS. GEMSS is one of my absolute favorite projects out there. How did we think about this in the first place? Way back, I guess before 2012 is when we developed this website. We found out from genetic clinics that they were getting a lot of questions from schools. So we realized this could be an area for us to put something out there. There really wasn't that much about how to make people more comfortable in schools. And you might know, or this might be a familiar statistic, about 1 in 20 kids in neighborhood schools do have a genetic condition. So we wanted to assure everyone that anyone could succeed in school life. So it's really just all about learning about it and taking away fear. And who would have that fear the schools, the teachers, all of us. I suppose we could at some point, but it helps to just get information about it. We really wanted something super simple to use and understand, which is not easy with genetics. So in writing this, it was quite a process of developing content, and then we had an expert who would go through and read and say, no, families don't need this, 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 this. Let's concentrate this. Let's bring out the most positive things first. There was a lot of back and forth to make it be as simple as we can and as positive. We knew families and schools wanted something that was vetted. So again, this was developed by genetic counselors, geneticists, a parent expert, and then sent to parent groups. All the condition information was sent to like the Turner Foundation, or to kind of give their seal of approval as well. It's free, it's updated. In fact, we have been working to, we updated it this past year, and Dr. Leah Burke was the one who was doing that, updating, and she was the head from the project in the very beginning. It's really her brainchild. So, oops, let's see. Okay, yeah, I guess we also really wanted something to stress high expectations as well. So it's really geared towards 3 different audiences. Initially, it was geared towards schools, helping to develop lesson plans, training, how to amend an IEP or 504 plans, helped plan snacks and activities, things like that. Families it's really useful to have content to share with the school or the doctor or even their family and friends who maybe don't have a very good understanding of the condition. Because it is very simply written and it's just a good starting point. As we got going on it, we learned from primary care physicians looking at it that, hey, this is actually brilliant fit for primary care too. And it would help them with parent coaching, doing letters of medical necessity, and just kind of really collaborating. So it's not a diagnostic tool, but it's just useful for building that healthcare plan in the school. That's, I guess, what I want to say about that. For every condition, and I'll show you an example of this, we have a healthcare provider version that has these categories of information: physical characteristics, recommended routine surveillance, like what checkups should they be getting, what are the emergency protocols, specialists who may be involved, and that could be a long list or a shorter list. We have a sample form of a little paragraph about medical necessity that somebody could just print and insert into some other document. Then we also help them see the 7 main aspects of school life. These are all the conditions we have. There are 37 right now. The last groups that we entered were quite complex, and I have to say mitochondrial conditions was one of the latter ones because it's really encompasses so much variety and different levels. But these are the conditions. And I wanted to show you a bit about how it's organized. But I think to do this, given the time, I'm going to take you right to the website and show you. So here we are at the GEMSS website. And let's just go ahead and go to a condition. And I was thinking we might just go to mitochondrial disorders. So every page starts with an at a glance section. Not too much information, this is it, but it tells about how prevalent it is, what kind of how can you describe it? Just a basic, that's a great amount of information really. But if you want to learn more, we have a link to kind of a deeper dive into much more information. This one that has all these, we use a lot of drop-down boxes and bullet points, not to, as hopefully it's not as overwhelming as it could be. So we also have a story where you're meeting someone who has that condition and they're describing kind of the successes that they've had in school. What are the challenges, ending with advice to parents and advice to teachers. We also have these, we highlight medical, dietary, education supports, behavior and sensory, physical activities, absence and fatigue, emergency planning, and then resources. And for every one of these, I'll just go to education report. We think, if I were a teacher, what would I be thinking? I'd want to know, what do I need to know? And then what am I going to do about it? So that's how it's organized. What you need to know, what you can do with bullet points. So there are also a number of resources that includes a special page on the IEP and 504 plan with a lot of links. There's actually content on sometimes undiagnosed conditions, because as we know, it could be a long time for getting a diagnosis, or a child may never be diagnosed. So that's part of our thought as well. And I think I'm going to go back here. Did anyone have any more or have any questions?
Thank you, Karen, so much for going over the GEMSS website and also your very personal story. And thank you for being so brave and sharing that with us. We got a couple questions for you. And so someone asks, how do we look at getting a condition added to the GEMSS website?
That's a great question. And we, at this point, we are not really adding anymore because our grant didn't fund adding more at one period of time. That's changed just recently. So it may be something we can look at in the future. Contacting me is what I would recommend. And I think I have there's my email here. And I'm always happy. I do keep a list and we do keep tabs of that. So I do encourage you to do that.
That's great. And also, as for a few comments that have come in, some individuals are very happy that you're presenting and just freshly learning about NERGN. And Cynthia, who is attending, says that GEMSS has been so helpful, not just in New England, but across the country and even in other countries. So you guys are doing an amazing service for all of us. And in regards to education, within the New England region that NERGN serves, what new challenges have the rare diseases and disabilities communities encountered since the pandemic?
I think the answer is that they've been experiencing the same things that all areas of the country have been doing. We've been, we have regular meetings with the Family Voices partners and really trying to see what we could do to help them. And so I'm aware that they are all really focusing on trying to provide advice and talking to people how to learning what's in your state to help with that, how to make the decision about going back to school. All of the Family Voices organizations really are a wealth of knowledge, and they all do some unique things with that. But I think you can find that that's the issues. It's what we all have. I think one that's unique
Absolutely.
a little bit, or might be unique to people with genetic conditions, is trusting the vaccine. At what point would you do that for your medically fragile child? It's not necessarily the same that we would all same conclusion. So that's one thing that had made me thought. Also, I've learned that telehealth, teleservices, teleeducation doesn't work for everyone. So even if you have a connection and a computer, it does not work for all kids. Sometimes it's even can set kids off sometimes. So those are the kinds of, I think, unique issues.
Right. The different modalities of education delivery.
Right.
And we have time for one last question. So an audience member asked, you mentioned that NERGN has a focus on underserved communities. Do you have any information about the intersection of the rare and underserved communities?
Wow. I don't think I really do specifically, but I'm making a note. It's such a good question. We've been trying to reach, kind of focusing on the Latino communities in Massachusetts and the American Indian communities in Maine, and also potential involvement in Vermont through Nepalese and Somali and other kind of new Americans that they have there. But I don't really know, how that relates with rare disease too. But I'm making a note because that's a very good question for us to think about. Thank you.
And thank you. All right, thank you, Karen. And I'm gonna pivot to Julie, who has a couple of announcements to make.
Yes, at first I want to say thank you, Karen. That was a great presentation, as usual. Well, thank you so much for bringing that to us. It's such a valuable resource, I think. And so everyone, we're going to take a short break. And before we get back on with our next program, I would like to encourage you, I know I keep repeating myself, but I want to encourage you to please go to the exhibiting booths and click on those zebras, because at the end of this day, we are going to be pulling the names for the winners who did get the most points for that. Also, the surveys. We do have a survey, and we really, really want your feedback on this conference and ideas, the good, the bad, all of the above. And we also have the survey in your briefcases, so please make sure you take that with you. So if you are not able to finish the survey today, you can get it to us as soon as possible. We would really, really appreciate it. Can't stress that enough for you to return those surveys to us so that we can better our programs. So with that, thank you so much, and we'll see you at the next presentation.
Thanks, everyone.
Thank you.
Bye now.